Three important factors that makes our tooth susceptible to tooth decay. Very often when we have patients coming to our practice, we say that we hear people saying they take good care of their teeth, but in terms of brushing their teeth or in terms of their habits, but they eventually end up with a lot of decay in their mouth. But they know somebody in their family or friends who don't take good care of the teeth, but they are more resistant to decay. Why is it so? What are those three factors? This is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja, Namalapuram since the year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel. We've got a whole bunch of videos coming out in the next 1 year. So what are those three factors? Number one is a tooth structure. So when I say a tooth structure, how resistant is our tooth structure to decay? That is number one. Number two, of course, the most important thing is our dietary habits and our hygiene habits. What is the food we eat and what are the steps we take to ensure that we maintain our teeth? That's the second most important thing. The third most important factor is our saliva. Saliva can be protective or saliva will not be protective. Whether is our saliva protective against tooth decay or our saliva is making our tooth more susceptible to decay. So these are the three main factors which makes our tooth susceptible to decay or not. Of this factor, let's take at one particular thing, our tooth structure. If our tooth structure is more prone for decay and if our saliva is not protective, can something be done about that is what that we will be looking into it now. Because if you look at a tooth structure, it's not going to be flat. It has got a lot of elevations and depressions. Those depressions are where those pits are. It's called those pits and fissures. That's where food gets caught. Once the food gets caught there, bacteria that is there in our mouth acts on the food, produces acids. And these acids slowly soften the tooth structure. The softened tooth structure is what basically causes decay. So when such a process happens, the entire thing is happening in our mouth, which is filled with saliva. Our saliva can either be protective or not protective. So if our saliva is alkaline in nature, automatically what happens, the acids that are produced there in the mouth gets neutralized by our alkaline saliva and the saliva protects the teeth. But if the saliva is acidic in nature, it contributes to more decay that is happening. So if we have a saliva that is acidic in nature and also having a tooth structure that is less resistant to decay, the best thing is to meet your dentist. The dentist can prescribe you certain special toothpastes that are available which are highly calcium enriched. So these pastes, when used in addition to a regular brushing, what it does is, so these pastes will release calcium. So this released calcium mixes with the saliva, increases the alkalinity of our saliva and also causes the movement of calcium from saliva to the tooth, causing the tooth structure to become more remineralized or more resistant to decay. It's a simple tool which can be used to ensure to make your teeth more resistant to decay and to prevent your frequent dental visits requiring a filling or a root canal or otherwise. I hope we have addressed this question. If you have any other questions, please do ask in the comment section below. We'll be happy to answer. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.